the end of your time with us in March, at the end of March. Dr. Martin will be a great resource for you as you are writing for your DFC grant, looking at some of the evidence-based interventions for addressing opioid misuse in your communities. I'll let her do her bio, but she has extensive work across the state of Arkansas, so we're super excited to have her on the team, but she will be setting up meetings with each of you individually to go over like what your communities look like, how you guys can approach opioid misuse in your community. So,
yeah, and I'll tell a little bit about myself some more, but first of all, let me know who else here. I know you gave me a list, but kind of tell me who everybody is. So, where are y'all from? Texarkana. Okay. Well, I'm the doctor for River Ridge and Swakmike. So I know a little bit about
I'm
that.
from Hot Springs. I have an office next to yours.
Oh, okay. Are you Tracy?
I am.
Okay, hi. Nice to meet you.
Nice to meet
Yeah,
you.
you do. Okay, and your organization is?
It's where you are.
Okay, where you are.
Mhm.
Okay. Awesome. Okay.
We're with the Cleveland County Health Coalition. I'm Judy Crowder.
Ashley Sanders.
Donna. She just got
I just got
married this
married.
weekend.
I'm her husband, Jason.
Nice to meet you.
Nice to meet you.
They're on their honeymoon this week.
Okay. Well, there's thing to do, right?
Yeah.
Team sport.
Yep, yep.
Very
And,
good.
Anyway, Heber Springs.
Awesome. Work that ER up there too. Go ahead, you good? Yes, you. Yeah.
Okay, Julian White. I beat that in power removal. Deshaun White.
Okay.
We're in
Where-
Pulaski County.
You're Pulaski?
Mhm.
Okay, awesome. Very good.
Robert Steps, Michael Steps, and we're from the Change Organization, which stands for Changing Hearts and Navigating Great Enemies from England, Arkansas.
Oh, from England. Okay.
Yes.
I know where England is too. I trained in Palm Bluff. I lived there for 8 years.
Okay.
Driven back and forth. I live here now, but I've driven up down the highway.
Yeah.
Okay, in Pine Bluff?
Yeah. Yeah, that's where I trained. I trained at AHEC in Palm Bluff. And was an ER doctor there for several years, and then moved to Little Rock. But I guess I'll start here. Anybody else? That's all support.
I'm also in support. My name's Rick Collins. I'm
Okay.
here supporting the coalition.
Oh, awesome. Very good.
And I'm Dorothy Cheney. I'm the trainer for this group. So.
Awesome.
Although I feel like I'm from Arkansas at this point.
Okay.
Somebody needs
Time
to
to
adopt
rest.
me.
Yeah.
So, yeah.
So I'm Dr. Kristin Martin, and I am a physician. My initial training was in family practice, as I say, at AHEC Pine Bluff. I then was an ER doc for 15 years, so I worked for Jefferson Regional, I worked for Baptist, I worked Heber Springs, Arkadelphia, Stuttgart, DeWitt, Monticello, you name it. I did a lot of work. As a single mom with twin boys, did a lot of work moonlighting and seeing what it's like to be in rural Arkansas. So I have a significant passion for rural and underserved, because I tell people I know what it looks like when people don't get help, right? I know what that looks like firsthand. And so I actually had moved to Little Rock, worked in Hot Springs, but I was the ER director up at St. Mary's in Russellville. And in 2020, when COVID hit, I tell people I was working one of these different ERs every single day for 18 months. A different place in the state, making sure people were taken care of. And what I saw was more cases of mental health crisis and more cases of overdose than I did actual cases of COVID for 18 months. And I said, we are missing the boat. We are missing the crisis. And that while at the time as ER providers, we were pretty prideful, which is not a good word in the land of recovery. But we were like, hey, we're out here doing all this different work. But what we were realizing is that the ER was no longer the front line, right? That the communities are the front line, because it requires all of us out there working, doing interventions, trying to prevent the problems from happening so that people don't even have to make it to us in crisis, or I don't have to call another mom and dad and tell them that their child has died from something that we could have prevented. And so I was doing some work for what was then Freedom House Treatment Center, and I was the medical director for a child advocacy center we set up in Russellville And I started to see a connection between a lot of the patients, a lot of the children, a lot of the trauma that was experienced. And so I took a team of some of my ER providers that were all family practice, and we started going out and trying to reach people with opioid use disorder. A lot of people couldn't get to their provider. A lot of people wanted help but didn't know who to call. They couldn't even get into the regular doctors. And so we started doing that work, and I would go and meet people at ER family rooms. I would meet them at McDonald's, or if there was a coffee shop that was open, in my car. People got to kind of laughing at me, and they're like, "You're that little doctor that drives them down the highway." I'm like, "Yes, I am." But to me, it was worth that connection when people really wanted help. They really wanted solutions. And we, as not only a state, but as a country, obviously we're not meeting the needs, right? And we were so focused on COVID that we weren't focusing on everything else that was going on with the opioid crisis and the mental health crisis. So I went and got trained to be addiction medicine board certified and sit as the head of the American Osteopathic Association, so I'm the lady that writes test questions. No, not sure that's a good idea. But anyway, for all the doctors and people that are wanting to train to do that, I said I'm passionate about the rural and underserved. I have River Valley Medical Wellness, which is my outpatient clinic. I do integrated health care. So I kind of stepped out of the ERs more, and I believe that when you're looking at people with use disorders, that the fact of the matter is that you need to look at the whole person, not a slice of the pie, right? But the whole person. Their addiction does not make up the totality of them. Their mental health issue does not make up the totality of them. They are a whole person, and so because of my background in family practice and things, we set up an integrated healthcare clinic. So we do primary care, mental health, and addiction medicine, both at our clinic in Russellville, our clinic in Hot Springs, that you're familiar with. And then I wanted to do mobile health clinics. Why? Because I know what it looks like in rural Arkansas, right? And every community has a lot of the same problems, but everyone is also unique. And so it's having a cookie cutter approach and just telling everybody to haul up to Little Rock to get, run through a treadmill of care. That isn't how I like to practice. So not there's anything wrong with all of our different programs here, but I believe in a different approach. So I have 2 mobile health units. We started our nonprofit division, which is ARMOR, or Arkansas Mobile Opioid Recovery. So, if you see a big purple RV that's driving down the road that says ARMOR on the side, we got our first support from the Attorney General to do that. And we got a second unit awarded to us from DHS. And in 18 months, we've taken care of over 3,800 patients in rural Arkansas with substance use disorders.
All right.
So that's Malvern, Arkadelphia, Morrilton, Perryville. Perry County doesn't even have a doctor. There's lots of counties that don't even have physicians, let alone specialized care. So as I said, that's what I want to pass about. Sounds like I work all the time. I do. And then I'm the physician for 6 of the state treatment facilities: River Ridge, Texarkana, Harbor House in Hot Springs, Gateway in Fort Smith, Sozo Recovery Center, faith-based, evidence-based recovery center, Harmony Hill Ranch, and someplace else, but don't tell me, let them know I forgot about it. Renewal, we go to Renewal,
Yeah,
we go to Renewal
I see it on
and
there.
yeah, we go to Renewal, Ranch and, I forgot. Okay, excuse my potty mouth. But anyway, the fact of the matter is, I work in outpatient, but also work residential programs. We take our mobile unit to the Alexander unit, which is where the incarcerated youth are. And we have, River Valley, my clinics won the youth award to be able to go and help roll out services to be able to screen for youth, train all the teachers and counselors about that, and be able to provide peer recovery services and different options for all of our different counties in their setting But start with those youth that are rolling out of incarceration, so that hopefully we can help them build resiliency and stop the cycle. Because a lot of people I see in residential treatment now, and I say, tell me when you started using substances. And when you hear, I was 8, I was 9, I was 10, and I say, and how did that start? Tell me about that. A lot of times those situations are, the first time they ever used drugs was because their uncle shot them up IV with some methamphetamines or some opioids. And so that's not just a kid problem, that's a family and community problem, right? That we can all take a part in. So that was a really long story about what I do. But hopefully I'll be able to help provide you all with some support in whatever you're interested in and excited about. I will do the best I can. And if I don't know the answer, we've got a great network of people that we can lean on to help provide those answers. So.
Love this. So do you have a little bit of time?
Yeah.
Okay.
Yeah.
So I'm going to set the stage from some of the work that they've been doing, and then I'm going to turn y'all loose. So I love that you just mentioned, what did you start using and when? This group has been really looking at primary prevention. How do we stop and really being data driven? So that's what we're doing now, is looking at data. How do we get data? So I can see number one, data. One of the questions that we always talk about is, when you talk in your communities, what did you start using and when? And very often what people say is, I started at 8 or 9, taking a few cigarettes out of mom's purse,
Right.
And so that's really relevant, because when we go way upstream, the substance of first use is very often what those big three, right? The THC, the nicotine, and the alcohol. And there are some kids that start taking out, but so that's where we are, is we're
Sure.
way upstream, but also looking at the prescription misuse as well.
Right.
And so from a prevention standpoint, a lot of the work that they're working on is alcohol. The big one that everyone's seeing is THC, vaping, nicotine, all of those. So maybe you can speak a little bit to that connection,
Yes.
and I would love for you guys share what you've learned and what you've been doing.
Yes, so we do, and we get a lot of referrals because there just aren't many providers that are willing to talk to youth about those items. Even pediatricians, we find that the pediatricians are sending, if they find out that a kid smokes cigarettes, vapes, has smoked some marijuana, gotten in trouble at school with something that is not what we consider the harder drugs or the other illicit issues, well, I guess they all are when you're under 18, but nonetheless, we find that the pediatricians are sending referrals to us because they just really feel uncomfortable having these conversations. I also see a lot of grandparents who are the ones coming in and saying, hey, they're vaping, we don't know what this means, but we're terrified and we want to support them in any way we can, but we just don't even know where to begin. And I love those, you know what I mean? It's like, oh, this is great if we can start out early on, like you say, early on in the process, educating, talking. I know Tracy knows, as far as just discussing, what, for me, it's well, what starts that? What do you use that for? What do you use the, marijuana for? Kind of, what does that do for you? Is there another issue that's going on that's not being addressed that maybe somebody needs some support with? But so important, the prevention side, and really, of course, the longer that a youth waits to do any of that, right, the less likely they are to develop a substance use disorder or to have multiple disorders with that. And so it's so important. And I think of all the times that we say, oh, kids are just being kids, and not really checking to see if they're okay, or validating, sitting next to them. This is part of what I tell people, like, do you sit down at the kitchen table and talk? Do you sit down next to them, or is it always over them? What you should do is teaching people to listen to the youth, to the families, to the communities as far as what's needed, because a lot of times they will really open up and tell you if you ask the right questions and you listen long enough. So,
What did that, I'm gonna turn it over to you guys, what you found. Here's my challenge for you. As I'm setting this up, I want you to think of a local condition that you discovered in your community related to youth use. So this is a coalition-based training.
right.
And so coalitions are looking at supporting, sort of shoring up the environment. So we often say that the role of a coalition is to create an environment where the easy choice is the healthy choice. So definitely talking to youth, providing resiliency training, all of those pieces are really important, and also looking at policies and systems that exist within the community. Because kids exist within communities that normalize behavior and where they can get the substance. And we always say, if you can't get it, you can't use it, right? So those are the kinds of lenses that this group has been doing, is how do they bring together, and SAMHSA, don't have to spell out that acronym, you know it, yay.
I do, yeah.
Is,
Work with them all the time.
I know, right? I was like, yeah, I don't have to spell the acronym. Is we identify 12 key sectors that need to come together, and that collectively a coalition says, what's happening in our environment that we're all individually working on this issue? How do we collectively come together and create a healthy environment?
Yes.
And so over the last 3 weeks, they've been looking at their data and identifying, and I love what you said. You had me at, every community is the same, but every community is different. Yes, every community is different. It looks a little bit different. And they've been working really hard in identifying what the behaviors look like. So who would like to start and just share what you found in your community, what you're working on and what your local conditions are that you're addressing? Robin.
Yes, ma'am.
What I found out in the England community, the local conditions is community doctoring, sharing prescription medication, selling their leftover medication, and just among themselves, just taking it, not going to the doctor for anything, just sharing the medication. So,
Why do you think that is?
because it's a norm, and they don't feel, and a lack of awareness and the dangers in it. So, not thinking it because it's prescribed to somebody,
Right.
it's okay for me to take it because it's a prescription drug, and that's what I've seen throughout the community.
Sure. Now, England has a high rural population, as far as a lot of farming around there.
Yes.
Do you find that a lot of people do the feed store kind of, that they think, and I said do the feed store, there's lots of people that seek out, and they say, well, if my horse can take it, if my dog can take it, if my such and such can take it, do you find a lot of people feel that way, as far as, have you seen any of that, as far as in the?
You mean literally?
Yeah, literally.
And I haven't seen that.
Okay. We do,
No,
I mean, we do hear a lot of that.
That's new.
Yeah, we do hear a lot of that, or kind of home concoctions.
Yes. Oh,
Yeah.
Texas, where we are,
Do what?
where we are in Texarkana,
Right.
we're a border town.
Yes, sir.
And when the pandemic hit, there were a lot of people that were going to feed stores, and get this, some kind of,
Ivermectin.
ivermectin, and they were taking it.
Mm-hmm.
And, and you didn't have to have a prescription for it, you just walk in there and buy it.
Yeah. Yeah.
And they said that it works, so, we had had a big influx of people going to the seed stores to get that stuff.
Sure. Sure. So lots of medicine being traded and different things like that. So does your community have a take back day?
yes, we do have a take back, but it was more, we really put a lot of emphasis on it some years back, like before the pandemic.
Right.
Now, the town, I don't hear them talking about it. So, it's something that we tried to bring more awareness in this year,
Sure.
because it's located in the police station.
Right.
But that might be a little intimidating to bring it to the police station, so we might need to really relocate That's what I see now.
That's-
Because they looked at us, you putting that in the enemy's hand, they watching me, they think I'm doing
But
so.
it used to be you.
A setup.
You got at pharmacies, right, that Walgreens had a box and other places,
Yes, I
you know.
believe that
You used to
would be
have a
our
box,
next
but
move.
I think they got into some security
Yeah,
issues.
controlled substances can't be
Yeah.
taken once, but a great strat. So a couple of things. Love this. So and this will go in your GFC application is perfect. I love that concept of being able to describe it as community doctoring. And there's a couple of things that just come to mind is a lot of times definitely the DEA take back event, because then you can do community based. Great activity for your coalition. And also some other strategies, because sometimes with the community doctoring piece, people, it's not that they don't know how to get rid of it, they don't want to get rid of it.
Exactly.
That they're either selling it or they're, right. So that's, like I always say, like those DEA take back events or this, that's an ingredient, but it's not going to bake the cake. It might be the flour, but we need to find all those other ingredients too. Up to and including, you said people don't know, it's a felony to give your Vicodin to your neighbor.
You know, I brought that up even in a sermon, a Bible study. And I brought out the fact that, you know, we are making, yes, we are criticizing it when it's done on the street.
Oh,
But motherboard, listen, when you sell your pill, you are a drug dealer.
I bet there was lively.
The church got quiet.
Well, so I was gonna ask you,
What?
what,
I mean, you are dealing.
Absolutely.
yeah.
Because if that person's name is out on the bottle and you're selling it, it is the same exact
it.
thing.
Yeah.
So besides between each other, the other thing, and you probably answered it for me right there, where are the other centers of influence in your community? Church,
Yes.
right? Is there some other centers of influence that you can bring together to have messaging where people, you know, if you tell me something one time, I probably won't remember it because I'm a little ADHD. All right, but it's that reinforcement of here's people in my community that I respect, that I know are successful, or they cared about me, or things like that kind of reissue that theme of whatever your platform or your message
You need
is.
a billboard with a drug dealer doing a deal thing and then Granny handing out her
Yeah.
bill side by side and say, both go to jail or something like that, I don't know.
You know, when we're dealing with, especially the elderly community, they trust two people, their doctor and their pastor. And so we do know, and actually that was one of the points that we brought in our last coalition meeting, that we need to get more clergy or faith-based leadership involved in this, because that's who they trust. And if they start spreading that message out more often over the pulpit, over Bible studies, then I think it will go further.
Sure. Well,
And for professional people, I would think as educators, like coaches and teachers.
Coaches.
Coaches.
Yes. Yeah,
Oh,
because
yeah,
we had the
That's
football coach to be the one to
Our
be
speaker.
our speaker.
oh, awesome.
And that pulled in more young people to listen. And that's, so on the other side of the spectrum, the young people, they listen to their coaches.
Yes.
I mean, a teacher could tell them one thing, and they be like, But if you tell the same message to the coach, and then the coach tells it, they listen more.
No, I think that's great. I think that's great. And I know some of the campuses have done the One Pill Can Kill campaign, right?
Yes.
That's really kind of on some college campuses and stuff, but even some of that, some of the people who support that the most are the pediatricians, and there's other people we talk about it in the emergency rooms, but a lot of times it's not that somebody's even intentionally trying to do something harmful. It's grandma has an extra hydrocodone.
Right.
That's
She
right.
actually drops one on the floor, can't figure out where it is, hurts where she doesn't want to bend over. It stays there, then the grandkids come over, and baby swallows a pill, right? That's not a matter of intentionally trying to harm or to do anything, but it's an example of how every generation needs to have a part in understanding how they can prevent a death, a death or
Right,
some
yeah,
other
and
kind
that's
of.
from the lack of awareness. They really just don't know, and that's what the issue is in the school. When we're talking about the vaping, you know, I shared with the group earlier that we had a third grader this past week, and that vape was bright yellow. So the child brought it to school and had other kids, and it kind of resembles a whistle. And the other kids were putting it in their mouth, and they were passing around. Right now, I don't know if there's something in it or not, but the child that ended up with it has a hole in his heart and he has asthma real bad.
Oh, wow.
So it scared the mother, just messed her up, because she didn't know what was in this thing or how it's going to affect him later. But it's just they don't know the danger, because most of them are switching. The parents, a lot of the parents are substituting the vape because they feel like they really believe that it's going to help them to get off the cigarettes, and they using it saying I'm smoking this because I'm trying to stop smoking cigarettes, but yet you're smoking something that's equivalent to a whole pack of cigarettes in one container, but they don't know that.
Well, and a lot of them have Delta 8, Delta 9, different
Right.
things like that that are cannabinoid derivatives that are harmful. So I can tell you some ER cases about all the different things, all the different substances found in vapes, and really people don't believe it until you hand them a urine drug screen that says, this is all the stuff that was in it. That's all you say that you know, let me just share with you for education. And there's some people really upset about, I don't mean to laugh at it, but I mean, they're really upset and we're like, I swear I have not done these things and now I'm really angry. And I'm like, be angry at your vape shop, you know, be angry at your friend that said, you know, whatever, you know, that this is okay, or sharing it. But
Julian, would you mind sharing? Because that's exactly what we've been talking about today. Because with this grant that we're writing, they have to identify the substances specifically, because the data are different, the interventions are going to be different.
Right.
But with vape, it's really it's unique, because youth using vapes, it may be nicotine, it may be THC, they may not know. And I think that's what we just talked about, right? Can you share a little bit of what you were learning in your community?
So we've been doing workshops in the community. One specifically is at a church in North Little Rock. We have 2 different zip codes that we're trying to target. What we've come up with is that they are collectively in the school systems going into the bathrooms and smoking together. They don't know what they're smoking. Nobody could definitively tell
like all
me.
of us that used to go outside and smoke cigarettes, have a talk break.
Right, but you knew you had a cigarette, like an actual cigarette. Yeah. So we don't know what it is that they got. Some of them could tell me because they are the ones that's providing them. In the North Little Rock sector, which is more the church community, of course, all of them is, it's everybody else, but yet you can tell me everything about what went on and who did it and when they've done it. So you was clearly in the space as well. So now we're recognizing that there is nothing to combat it. There's nothing to say, hey, if you do this, this happens. They don't take it seriously, whatever consequences are in the school, because it's only an in-school suspicion and there's nothing else. And what we've learned with Deshaun's, involvement in the school system, that they're not going to keep you out of the school system too long, because then they lose costs if you're out and expelled and all that stuff.
Right.
So now we're trying to figure out, and we were just sitting here before you came in, trying to figure out what that looks like as the community risk factors, and how do we be able to build up on the fact that they're in the school systems smoking and whatever else, and maybe it's advertising, maybe it's just the accessibility to it. That's what we are now.
Sure. Can I share resources
Yeah.
that I have?
Sure.
So I have Hazelton Betty Ford program that we have, like the youth programming, and then we have some adult programming that's a living in balance, and then there's, as I say, there's some geared towards kids that's really well written kind of information, and even some videos that have youth talking about why different things happen, that I think is helpful. Because again, if I say it, like I just became a grandma, so right now my boys think I get smarter and smarter every year, right? But when they were younger, if I said it, it was, oh, it's mom saying it. You know what I mean? Now, my kids paid for PA. That Coach Kelly, he says something. As a matter of fact, when I get mad at my children, I say, Coach Kelly wants you to act like that, just like what you said. I say, do I need to call Coach Kelly? Years later, 10 years after they've graduated, I can still say that, and they'll be like, oh, no, ma'am, no. Don't call Coach. So you're right. I totally agree with what you're saying with that. But I do have some, because with the vaping, besides the lawsuits that happened, it is harder to find some of the information that the kids will engage or believe in, but I do have some that I can forward to you as far as some of that and small videos or different articles that kind of are informative that you may want to take from. So, because it is a big deal. I see it right now in Hot Springs, the Second Chance program. They've started sending kids over for that. So kids that are getting in trouble at school, right, and getting like charges, kid charges, right, but still charges, that for vaping at school, not for marijuana, but for vaping at school, and so they get to refer to us for therapy, and then their parents being involved, and so we have them coming and doing some of that. But until we kind of even build some bigger youth programming, it's difficult. It's difficult to find.
One of the things you said too that was really important was when you said we need to hold the retailers responsible, and that's one of the kinds of things that we'll be looking at too, is like retail compliance checks and making sure that, so education is really important, and we use CADCA 7 strategies for community change. So we start with who needs to know what, how do we build skills, how do we provide support, and then we move into those environmental strategies where we're like, what policy can we lock in? How can we? And so I love all of this conversation, because as you guys are, as the doctor is talking, I'm putting those strategies where they belong on the 7 strategies, right? And so how do we, right? But that's how we get enough dosage, right? To actually change the behavior, is the support. And so far we've talked about policy, we've talked about providing support, providing information. You had talked about doing a poster campaign that the youth were doing. That's not going to change behavior, but if you plaster the school environment with that, that's changing the physical design. So I love this. This is great.
The posters, like I remember whenever I was a kid that we used to make it, and I'm trying to think of what it was. And I'm a few decades old. We used to make those for school. It wasn't Stop Smoking. Maybe it was Stop Smoking campaigns or whatever. We used to actually make it for our class, and we'd all have to like. Make me flashback to my youth. So.
Judy and Ashley, I know you guys had some really interesting local conditions that you discovered. Would you mind sharing one? We haven't talked about underage drinking yet.
Yeah, Heber Springs is a big resort town.
I do know that. I try to not work Heber Springs when it's summertime if I can help it. For our shift, because it is slamming busy. With all the lake.
So everybody, either has a family member or a friend with a boat, and they load up that cooler and away they go. Sometimes if they run out, they'll hop on a deck and on a dock and get some beer off somebody else's boat or whatever.
Right.
We also have a lot of second home lake homes around that sometimes get broken into, and that's the party spot, or they steal their liquor or something like that. So that's something that's kind of specific to Heber Springs.
Sure.
Or probably other resort areas too. But anyway, so that was one thing that we've heard a lot of anecdotal information about, and then what else did we have?
And Judy, can I just, because you mentioned this one too. Gosh, it's like you're a plant, like you're just. But what I love about this, you mentioned earlier, the longer they go without engaging in that first substance. And so that's why I asked you to do alcohol, because you're in the party town, and so many parents normalize it. Well, it's summer, it's only alcohol, but we know it's not just alcohol, and it's not just a safe activity as long as we take away the car keys or they're at the cabin.
Yeah, but see, they have golf carts out at Eden Isle, so they just go get on their golf cart and go down to the marina and help themselves,
Yes. Well, and it does alcohol so much. Matter of fact, I'm flying to Virginia next week to give a national lecture on alcohol. Alcohol so much, and I think about even my own youth, right? All of the depressing effects where then it leads to one more thing, right? And your inhibitions are gone, right? A lot of teenage pregnancies, right? A lot of other substances that come along in there because it seems like it's kind of okay. Just a lot of I'll say poor decisions. A lot of poor decisions that have a lot more repercussions that you don't even really have a concept of.
Oh, yeah.
You know what I mean? They're not thinking past tomorrow, let alone 3 years down the line, 5 years down the line, 10 years down the line. And it starts a cascade, you know what I mean? So yeah, really, not that all of it's not important, but we see a lot of things that happen with that, so. What, do y'all have any other questions? I know you got really knowledgeable ones in here, cause I see her all the time, but.
Yeah, she knows it all now.
Well, I was interested in our APNA data. We just seen where, 5 times the state average, our youth are getting prescription medication from their parents with permission. And so that's interesting.
Yeah.
It's gonna be interesting to do some talking to some people
I don't
and
know
see.
if that's Billy Bob getting hurt Friday night on the field, and so mom's like, here, let me give you one of my muscle relaxers, or, I mean, what parent gives their kids
So I have a thought on that.
prescription drugs, but.
My thought is that grandparents are raising children and parents are in addiction. And they're like, well, if you're gonna use with me. That's my thought. I don't have any data for that yet, but I feel like that's probably a lot of, because we have a lot of.
I've heard that. I'd rather have my kids drinking at home than out in the community drinking.
I think there's also a lot that if you already know inside and you have guilt and shame about what you're doing in your own disorder, then it makes it to where you don't necessarily feel quite as guilty if there's all the other people in the room are doing the same thing. Like, you know what I mean? If I went to church, I probably wouldn't show up at church if I was inebriated, right? I might need to show up to church, but I might not, because not that anybody else would judge me, but I would judge myself, right? And so I think it's one of those ways that oftentimes people don't think that they try to normalize maybe their own substance use disorder, and they're normalizing
so
it.
bad. They can talk their kids into doing it, because then they don't get any guilt from their kids.
The logic of someone with living experience who's actively using, the logic and the rationalization is very different than normal.
Right.
And so you see it as, okay, almost,
Yeah. I do think you're right, though. I see a lot of, especially in a lot of, and I say this, it's not just rural environments, but maybe I notice it more there, because we sit down and have more conversations with what should be multi-generational homes. And I grew up with 3 generations sitting at a dinner table, right? Grandma might cook some dinner, and then we'd all come home from school work, and we'd all go to the farm, right, and all eat together. We didn't have cell phones. We didn't have all those other distractions, to do. But now a lot of the multi-generational, I think you're right, it's grandparents taking care of grandkids, and a lot of parents in and out, sometimes incarcerated, sometimes in their use, sometimes sometimes they may be working really hard, they're just not able to be there because they're having to work really hard to support a home, right? But I've met a lot of grandparents who start using methamphetamines at age 65. And that's, the lady that looks like, she would sit next to you at church, and I'm like, wow, like this is, I thought that there was just one. And then when we go to all these communities, and a lot of it was because they would say they got introduced to it because they were having to raise grandchildren, and it was around, and they needed the energy, and they just didn't realize it'd be a problem. So if you have grandma who's not ever had a substance use disorder that starts using meth at 65 because she needs the energy to help deal with all the different problems, then, you know what I mean? Then where's your, it makes it difficult for kids to judge what is necessarily right, normal, appropriate. You have a lot of mixed messages. How's that? You know what I mean? Yeah, mixed messages. So, what about you all?
We'll let Rev talk about that, because we actually will be working in Miller County instead of Garland County.
Okay.
So.
Good afternoon, Dr. Lane.
Hi, how are you?
I'm here. I'm listening to you. We're gearing our project towards alcoholism
Okay.
And I'm listening to you, and now I'm seeing a change in order, whereas even though alcohol is socially acceptable, being for every day, matter of fact, it's a rite of passage for young guys and kids, 12 years old. I know when I was introduced to alcohol,
Yeah.
you hear it, have a beer. You know, it's okay. You with me, uncle.
Right.
And so I'm seeing this shift from alcohol to marijuana. And now we're introducing vapes, which I went to a workshop 2 years ago now, and they said that every time a person inhales a vape, that's equivalent to 19 cigarettes. And we're seeing people opting to vape as opposed to smoking a cigarette, not knowing the danger that's associated with that, because you don't know what is in that vape as far as the mixture is concerned.
Right.
Now, we are looking at an age group of eighth graders.
Okay.
All right, my granddaughter's an eighth grader, and she's staying with me. I'm a grandparent that's helping raise our granddaughter. Her mother had a stroke, so we
I'm
got
sorry.
mother, granddaughter there, and she's driving me crazy. I'm a neat freak, and she just took over one of our bathrooms, and it's like the guest bathroom when people come.
Yeah.
And there's so much stuff strolled all in there, and her hair is about as long as yours, and
Yeah.
she's always washing it, always doing something to it. Always it takes her 30 minutes to take a shower every morning. And I'm looking at, and she's never made a B in her life. She was the class valedictorian in kindergarten. She been the #1 student going to the 8th grade. So I'm looking at all of this, and I'm trying to formulate how can I talk to her about drugs and alcohol, because she's getting to that point now where peer pressure can come in, as well as she has a bunch of little friends, and I'm trying to think of how I could talk to her to influence her not to use drugs, and to not only be not for her to use drugs, but to be a messenger to her little group that she got, because she got like 10 people that follow her. So,
Sure. Well, and and there's kind of several different answers to that, but I think one of the things that there's so much, I know they've taken this a lot out of movies and ads and stuff like that. It used to be that we watched everybody smoke a cigarette on ads and all the different things, and so a lot of that's been taken out. But I think one of the things that I hear is that a lot of times kids feel they make that turn when they get that image that it's cool to be the person that parties. It's cool. I mean, I remember that, right? I remember whenever it was, if you wanted to hang out with the senior football players, right? Then you needed to be a cool, if you wanted to be a cool cheerleader, then you would be one of the ones that drank, right? And I think one of the things that, with all the information that's out there and stuff like that, is really some kind of clear messaging about that it is cool and that people do find it. If you think about the percentage of kids that are using substances, flip that around, and that the majority of people are not, right? Why is that? Because the majority of people believe that it should be something that you wait until later, or they learn how to have fun. So there's different ways to think about that. I'm gonna be honest, I became a grandmother a couple weeks ago, and I had boys, and this is a baby girl. And so I'm a little terrified of all the pink and bows, and I think if there's a little girl that's gonna act remotely like I did, that is gonna be like one heck of a deal. So I may be calling you for advice on granddaughters in a couple years here. But no, I do think that is absolutely true of how we sit down and talk with kids I think, number one, honestly,
Right.
right? Honest conversations, about their concerns, what they're seeing, what questions they have, instead of always telling. A lot of that can be there, but I mean, as I say, I've got different kinds of resources I can share that you may, something may, fit for you. And I think, as I say, just looking at the role models, kind of like we've been saying, for youth in particular, it is so important. It is important for us too, right? We all have people that we say, well, I wish I could talk like them, or I wish I had, you know, their kind of success, or I understood how to do business like them, or something like that. So, your granddaughter being, sounds like a role model with followers, maybe sometimes understanding, that, the importance that she can play in providing a message. I don't know what this is. Okay, here we go. Thank you.
Yeah, she's really, just cause she's my granddaughter, I'll say. So when I realized in the 6th grade she won every award you could win, I started buying her Ivy League hoodies and t-shirts. So the first one I bought her was a Princeton, and she told me what she wanted to do. I said, nah, I think MIT would fit your personality more, and she started laughing. So she researched all this stuff out, and she come back to me, she said, no, Princeton would be a better fit for me. And I'm going, okay, you never been on the East Coast, so.
Right. Well, and I think, you know, when we have kids that have so much access to information, right? If she's in 7th, 8th grade and she's already able to look up all the different Ivy League schools, feels like she knows what she wants and stuff like that. Part of what all of you all are combating, all of us are combating, is honest messaging, right? And honest messaging that can be heard and to reach people. And I think part of that, at least for me, that is relationship building, right? I can tell people things all the time, but if I don't have a relationship with them, then they're more likely not gonna listen to me. I know I felt that way before about some of the different institutions. I'm like, I'm so tired of hearing them tell me what to do. I'm gonna do whatever I wanna do. Or they don't understand me. They're not hearing me, right? All those things. And so I think that is a really important part to start in any of this. Whether it's the other people that you're building, you know, you're teaming up with for your coalitions, or whether it's the granddaughter sitting next to you at the dinner table. You know,
That's the secret right there, is the dinner table.
Yeah.
Those
I'm a firm
conversations.
believer. I feel like maybe, like, I hope that's still politically correct to say that we should all sit down and eat dinner together and have community.
It is an evidence-based protective factor. Yeah,
Right.
there
I think it
is
builds
some levels of
resilience,
evidence.
right?
Yeah,
I mean, it is
yeah.
one of
Doesn't
those
matter
things
what you eat, right? Sitting down. Yeah.
And we all like good food. Like, I whenever I had my boys, and people would say, how do you get your boys to come home? And I said, like, or the kids in the neighborhood to come to your house and stuff like that. And I said, I figured out, because I had twins. And I really didn't know how to cook like my grandma did or anything else like that. I was not a wizard, but I sat and learned from everybody that I could, because I said, if I can make good meals where those boys come home every night for dinner, right? You know, get to their stomach at least, and maybe I can keep them somewhat okay, right? And then you got half the football team at your house. You're like, wait a second, that grocery bill is getting really high. I hope everybody likes spaghetti and chili. So, anyway. So, Tracy, do you have anything you want to add about, or questions you have? No?
No, and I'm sorry, I'm gonna have to go. 'cause
You're
I have an
fine.
appointment outside of here. that
You're
I
fine.
have to go to.
You're actually in my same office, but I'll be in Hot Springs tomorrow.
Okay. Well, we'll be here all week.
Oh, okay, all right, well, we'll see you then.
Doctor, it was great that you came and that we had this chance to connect with you, and we look forward to connecting with you over the rest of this project. That's fantastic.
And I will give y'all, I think I brought cards. I will give y'all one of my cards, too, if you want. Is that okay?
You are in Pine Bluff now?
Do what?
Did you say you are you in Pine Bluff mostly, or?
I am not, but my mobile unit is.
Okay.
It goes to the Opportunity House in Exodus.
Do you ever go to schools?
Pardon?
Do you have those?
So we are, well, we don't go to the, here, I'll just give you the address.
Just give me one, I'll send an email to the whole group and include you, so everybody's got an email. Does that work?
Yeah, kind of funny,
I
it has all
just
the
need an
other,
email for you.
yes, that would be fine. That's terrible, but I got so much stuff in my purse, and I'm sorry, I can talk all day about stuff.
No, this is fantastic. We're in Virginia, you guys.
I am going to Roanoke to meet, to.
Roanoke, look at
To
that.
the ACM meeting there, yeah, doing a lecture on alcohol. There you go.
Awesome.
For doctors.
So, yeah. So
Yeah, I was gonna say, it has my cell number on there.
Perfect.
That,
What
or
I will
just
do is-
email me and I can.
I'll send an email to everybody and then make sure. Awesome.
Yeah.
Round of applause for Dr. Martin. This was fantastic. Thank you so
Yeah,
much.
no, thank you, well, thank
Thank
you
you.
for letting me interrupt the process, and,
Oh, no.
and any, I'd love to see like, what you.
Absolutely. Yeah.
So I
Yeah.
can.
Here, you know what? Well, this isn't gonna tell. Let's, yeah.
Do you have one that's just like a PDF or something you can
I
send?
can
Or
send you,
link?
I can send you, yeah.
Okay,
Let's
that would
have
be
a time.
awesome.
Maybe, yes, that sounds perfect.
You just let me know, so I'll look forward to working with y'all. Let me know if you have any questions or how I can be of help, so.
Thank you so much. Thank you so much.
Oh, and is everybody going to the Stop Overdose Conference?
Yeah, we'll be there.
November, November 18th, Hot Springs, all day, Attorney General, free. Isn't it free?
It is free.
Yeah, I think so.
I have a link if anybody wants to sign up.
Well, that'd be good, put it on paper somewhere.
Yeah, let's put it in the parking lot right there.
Now, last year, there was over 1,800 people there, and there's tracks specifically for youth, they're bringing in youth. Besides, we'll be doing some other youth, tracks for recovery and prevention and stuff like that. So if y'all haven't signed up, it's a good opportunity to get some more ideas.
Awesome. All right, we will take a break. We'll come back at 20 after 3.